All right, let's dive right into this explainer. Have you ever walked into a massive medical center and wondered why the wings are laid out the way they are? It can feel like a maze, right? Well, today we are taking a virtual tour to see a hospital not just as a building, but as a highly organized, complex machine. As you'll see, every single room is precisely designed around specific patient needs and, crucially, the life-saving equipment housed inside it.
Before we actually start walking the halls, let's ground ourselves in the formal definition. According to the medical dictionary, a hospital is a healthcare facility equipped for medical diagnosis, treatment, and care. Now, I want you to keep your eye on that word equipped, because the equipment is what truly dictates the shape of the building we're about to explore.
Here's our roadmap for today's tour. We're going to cover the anatomy of a hospital, outpatient services, inside inpatient care, diagnostics and treatment, and wrap it all up with the hospital ecosystem.
Starting with Section 1, Anatomy of a Hospital, or the fundamental blueprint.
So, at the macro level, our blueprint is completely categorized to keep operations running smoothly. The whole medical ecosystem is neatly carved up into these 6 physical components. It deliberately separates the flow of patients based on the intensity and type of care they actually need. The core medical functions happen in the first 3, outpatient, inpatient, and diagnostic and treatment services. And those are supported behind the scenes by medical, non-medical, and admin staff. Basically, this setup ensures a routine checkup literally never disrupts a critical emergency flow.
Moving right along to Section 2, Outpatient Services Explained, which are really the front lines.
Stepping into our first active wing, this is where folks come for diagnostic, therapeutic, or rehabilitative care without ever needing to be formally admitted to a bed. You just come in, get treated, and go home. This wing is split into 3 main areas, and they all operate at a totally different rhythm. You have the high-speed, urgent triage of the accident and emergency department, the scheduled, highly focused consultations of the specialist clinics, and the ambulatory or daycare center, which is built for quick procedures where you're heading home that very same day. Let's zoom in on A&E for a second. If you are brought in for a medical emergency, time is absolutely everything. The space literally has to be ready for anything. So, structurally, the A&E is packed with critical, rapidly deployable gear. Ventilators, stat lab analyzers for immediate, on-the-spot blood results, ECGs, and mobile x-rays that can be rolled straight up to your bedside.
Now, you stroll down the hall to the specialist clinics, and the vibe shifts dramatically. Depending on the specialty, the physical room actually shapeshifts. You might walk into cardiology and see a massive, heavy treadmill for a cardiac stress test. But take a step just next door into obstetrics and gynecology, the foundational tool is suddenly a tiny, handheld fetal Doppler.
Keep walking down that outpatient hall, and you start running into incredibly complex specialized machinery. Take a look at this hemodialysis machine, for example. It is the absolute defining character of the nephrology clinic, and it doesn't just sit there. This machine dictates the plumbing, the electrical power, and the spatial requirements of the room. It really proves that the hospital's architecture is, quite literally, built around the tools keeping people alive.
Okay, Section 3, Inside Inpatient Care, otherwise known as the residence.
Let's leave those busy front doors behind and head into the quiet, highly monitored residence wings. This is for patients who require accommodation, round-the-clock medical care, and specialized nursing. In this area is heavily categorized. It's sorted by patient demographics and the specific severity of their condition. It ranges from general inpatient wards, which might just be separated by gender or age, all the way up to incredibly specialized intensive care units. Every single department has a strict threshold for admission, completely based on how much continuous monitoring you need.
The crucial point of distinction here is how care is tailored by demographic. While your standard ICU provides urgent life support and intensive medicine for adults, the hospital designates a completely separate zone, the PICU, exclusively for kids. This space offers the highest level of care and continuous monitoring of heart rate and breathing for critically ill children. The equipment and the expertise are completely calibrated for pediatric physiology.
And they break it down even further for newborns. The hospital separates its youngest patients based on the exact level of intervention they need. The NICU breaks out the heavy-duty life support, like incubators and mechanical ventilators, for severe or premature infant cases. On the flip side, the Special Care Nursery, or SCN, handles infants who still need specialized care, but for less intensive medical problems. Again, it is all about placing the patient in the precise technological environment their body demands.
Let's look at one more specialized inpatient spot. If an adult patient suffers a severe type of chest pain like unstable angina or a full-blown heart attack, they don't just go to a general ward. No way.
They are rushed to the CCU, the Cardiac Care Unit. This place relies on an insane array of equipment to continuously monitor cardiac health. We're talking relentless, real-time data streams from EKGs, pulse monitors, and cardiac monitors, with defibrillators sitting right there, ready to go.
So we've seen where patients get their checkups, and we've seen where they recover under watchful eyes. But this brings up a pretty vital question about our blueprint. Where do the major medical interventions, the surgical procedures, and the deep internal investigations actually happen?
That brings us to Section 4, Diagnostics and Treatment, the real engine room of the hospital.
Welcome to the absolute engine room. This wing houses the ultra-sterile environments and the massive, heavy machinery required for major physical interventions. We are talking about operating theaters for surgeries, the intense environment of labor and delivery units for childbirth, radiology for deep internal imaging, pathology for complex chemical lab work, and yes, even the mortuary and forensic services.
You know what's truly fascinating about the operating theater, or OT? It's a ruthlessly sterile room built entirely around a very rigid ecosystem of gear. You've got the specialized OT table right in the center, blindingly bright overhead lights, surgical pendants physically dropping down from the ceiling, and highly complex general anesthesia machines. The architecture of this room exists for one reason: to support this specific surgical equipment and maintain absolute cleanliness.
And just down the hall in radiology, the relationship between the building and the medical machinery gets even more extreme. The architecture here basically has to bend to the will of massive diagnostic equipment, like MRIs, CT scans, and bone densitometers. These tools give doctors a literal window into the patient's body, which is amazing, but they require specially reinforced floors, massive power grids, and radiation-shielded walls just to operate safely.
Finally, Section 5, the hospital ecosystem.
Stepping way back to look at our complete virtual blueprint, we circle right back to our starting definition, a facility equipped for medical diagnosis, treatment, and care. The tools dictate the rooms build the wing, and together, outpatient, inpatient, and diagnostic services function as this brilliantly unified ecosystem. Information and patients flow seamlessly from the chaotic front lines of A&E down to the heavy diagnostic engine rooms and right up to the specialized inpatient wards to heal.
Which leaves us with a pretty fascinating thought to wrap up this explainer. As we've seen, the physical bulk and precise requirements of today's medical equipment completely define a hospital's blueprint. But as medical technology inevitably shrinks, goes completely wireless, or relies more and more on digital data, how drastically will the structural blueprint of tomorrow's hospitals change? Are we still going to need massive imaging wings, or will all those diagnostics just happen right at your bedside? It's definitely something to think about. Thanks so much for exploring this fascinating topic with me, and I'll let you ponder what the hospital of the future might look like.